Welcome back to City Trends. I'm your host, George Miller. We have a special guest today, and it's really exciting to have her here. We have Dr. Tania Pacheco-Werner, and she's going to share a little bit about what she's doing here in the Central Valley. Thanks a lot for coming on, Tania. I really appreciate it. And what you're doing is really important. Can you please share with our audience what you guys have going on right now?
Yes, so I'm part of a Fresno State Research Institute called the Central Valley Health Policy Institute. And what we do is we try to bring more understanding through data about what it is that our health conditions are in the valley, what are things that contribute to it that we can turn back through policy, or if there's things that help out, how can we have more of that as well? And so one of the things that we do is we study the air pollution a lot.
Yes.
And try to understand both what are the effects on people, are kids more affected than older adults, and if so, what are things that we are seeing that maybe can help reverse that?
And so what are some things that could help reverse that?
Well, one of the things that we see in terms of children that end up in the hospital is that they are exposed to a lot of the truck transportation. Mm-hmm. So a lot of the things that, anything that uses diesel.
Yes.
And so one of the things that we were trying to have a better understanding of is how you can obviously in a city still continue to operate like a
Yes.
city needs to, and yet really be attentive about where people live and what they're exposed to, and so how to reduce some of that.
So are those diesel particulates really devastating to young people?
Well, what we've seen in the latest study that I'm working on is that they're hard for everyone, but they're particularly hard for children, and children 5 and under. And then what we see is that then people who obviously don't have access to health care because they don't have health insurance, or maybe they're on Medi-Cal and it takes a long time to see a doctor, yes. They'll end up in the hospital for complications, for asthma or other breathing problems. And so things that could be prevented, really. So we are seeing that there is a link between that diesel particulate matter and children ending up in the hospital.
Wow. And you know, it's really important, like you really stress the preventative component. And the preventative component is really, really vital. Sometimes they look at the short term, okay, we're saving a little money by not offering services here. But then on the back end, they end up probably paying 5-10 times more than if they would have offered services on the front end.
Yeah, so last year we did a study on infant mortality, and in particular, we focused on all races, but what we found was a direct link between less money being given for programs for African American moms and prevention during their pregnancy, and the rise in infant mortality among African Americans. So we saw these kind of direct lines of funding going down and these rates of African American infant mortality going up. And as you can imagine, those aren't only kids that are going to unfortunately die, but a lot of them are born premature as well, and that's just extremely more costly to everyone in society when you have a premature baby versus a healthy full-term baby.
Oh yeah, I used to work ER for years, and we would get mothers in that virtually had no prenatal care at all, and it was because they didn't have access to it. And yeah, that would have been a cost, but the cost of not having it was astronomical, because now they're in an emergency room, and like you said, oftentimes they're born premature, the mother's a gestational diabetic, and that could have been treated early on, and there's the list goes on and on of all the things that could have been prevented if they had access prior.
Yeah, fortunately now a lot of the people like First Five and its commission, which is a lot of it is the county board of supervisors, and partners from hospitals to clinics to nonprofit organizations are gathering together and seeing how can we reverse this trend that we know exactly what caused it. And so we're actually having a follow-up event this month about this report that was published and trying to see what's happened in the past year about this and how we can continue to help both build programming but also build in things so that it doesn't always have to be a program, but rather if it was just integrated into if healthcare was just easier to access, then maybe we don't need like that many outreach programs.
Yes.
So really trying to find those long-term solutions.
Yes, yes, and you guys are doing a great job. You have a lot of work. I sympathize with you because you have a lot of work in front of you still. And if someone wants to get a hold of your organization, or do you have volunteers that participate as well?
Yes, currently I manage 3 interns, and so people come and either they want more experience, and so they come and they learn, and I basically kind of tailor what they want to learn to. I develop a work plan for them, and so we have graduates from Berkeley, UCLA, all over working with us and trying to learn more about the valley that they want to help out. And so cvhpi.org is where you can find more information, and also know that if you're an organization that needs data on a lot of the healthcare things, we have that available as well in-house.
Okay, so what disciplines are you looking for when you're looking for volunteers? Are you looking for primarily social workers, nurses, psychologists, or can they just be from any walk of life?
Yeah, so we have students that, because we're a policy institute, we have students that have been wanting to go into law school, come and work with us. We have people applying to medical school that work with us. And then we also have a lot of people that want to go into the social sciences. But in addition to that, we also routinely work with organizations one-on-one as well and help them develop a data or an evidence-based narrative for them as well.
Outstanding, outstanding. Dr. Tania is doing some great work here in the Valley. And if you'd like to be part of this or support her, or do you guys take donations? You're a nonprofit?
Yes, we do.
If you don't have the time, but you'd like to donate to this, please get a hold of her. This is Dr. Tania Pacheco-Werner, and she's doing some great stuff here in the Central Valley, and we were glad to have her on City Trends, and hopefully she'll come back. Great. Thanks a lot. I really appreciate you coming on. We have to cut to a commercial, and we'll be right back.